Okay, time for the SMX medical update. We bring in the good doctor, Dr. Joe McGinley from the McGinley Clinic, helping the Privateer Support Program, Club MX, and more. Unfortunate news for Joe SHIMODA, who came back from a huge injury to just get into 250 Supercross East. Now appears to have an ankle or leg injury. We don't know the specifics yet. He wasn't able to compete in the main event there in St. Louis. He's had ankle injuries he's come back from quickly before. Now, Joe, they said x-rays at the track were negative. That's not always the full treatment you get at a hospital, but when you hear x-rays are negative, but there's still enough pain for him not to race, what's the first thing you start thinking about there?
Yeah, I saw the crash. Again, scary things can happen when bikes are landing on you. And the fact that the x-rays were negative, that's great news. That means the bones are intact. There's no, dislocation at the ankle, no major breaks. So the MRI is going to be the next step no matter what. So there's a few things you're going to look for on the MRI. They already mentioned ligament injury, so you're going to look for the major stabilizing ligaments around the ankle. The way you got impacted and hit, that's going to be less likely. Usually that's a twisting or an eversion or inversion type injury. What I'm going to suspect is that there's going to be injury to the bone, impact, or bone bruising. Technically, that's called a bone contusion. And that's essentially you hit the bone, it hurts really bad. The bone shows swelling on MRI, and it's barely clear to see. So it's almost like a precursor to a fracture, but it really does feel like a fracture. The other thing the MRI can pick up are subtle little chip fractures that you really can't see on an X-ray. So it's very sensitive to all those type of injuries. And it's going to point to exactly what the problem is and how severe that problem actually is.